I'm here with Dr. Longnecker from Heber Valley Clinic, and we're talking about contraception. If you've chosen to not use a medication for contraception or a device or the implantable forms of contraception, your options are pretty much the withdrawal method, condoms, and the rhythm method. So let's talk a little bit about those. Let's talk about condoms first. How effective are they?
So condoms do deserve a lot of praise because they are the only form of contraception out there that also prevents sexually transmitted infections. So if you do have multiple partners or if you're worried about sexually transmitted infections for any reason, condoms are the only thing out there that will help protect you. However, as a form of birth control, they're not as effective. When they're used 100% of the time, they can be very effective, but unfortunately that's not the case. Usually we see about an 80 to 90% effective rate with condom use.
Condoms are also a good form of backup contraception. Say I missed a birth control pill. It's a good thing to pull out and use just to make sure.
Exactly.
Okay.
If you're ever worried that the current birth control method that you're using isn't working or that you might be pregnant, it's always a good idea to just use condoms for a period of time, take that pregnancy test, make sure that you know whether you're pregnant or not, and then you can just continue to take your other birth control method as well.
That's good advice. So other non-pharmacological forms of birth control are the withdrawal method and rhythm method. So let's talk first about when you are fertile during your cycle, and then that will help people know when they shouldn't have intercourse if they're trying to avoid pregnancy.
Right. A lot of the time people come in wanting to know when is the best time for me to have intercourse in order to be able to conceive. And so when you're talking about birth control, it's doing just the opposite. So most people have cycles that are around 28 to 30 days, once a month or so. On a 28-day cycle, the first half of the cycle is called the follicular phase, and the second half, or the second 2 weeks, is called the luteal phase. The second 2 weeks is always fixed at 14 days. So if you say I have longer periods, or longer time in between my periods than 28 days, let's say I'm 35 days, that second half of your period is still 14 days. It's just the first half is longer.
So the follicular phase is longer, yeah, and the luteal phase would be shorter.
And what do I mean by that half? That means you're ovulating on day 14 in a 28-day cycle, or day 21 in a 35-day cycle.
So it's good to be aware that you're also fertile or able to conceive for about 5 days leading up to ovulation, because sperm can live inside a woman's reproductive tract and fertilize that egg once it's released. So you're not just fertile on the day you ovulate.
Exactly. So couples who are planning to conceive, we usually say start having intercourse, 5 days before you ovulate, and then maybe 1 or 2 days after. However, if that same window exists, if you're trying not to become pregnant, that's really when you want to use some form of birth control.
In this case, if you're using nothing else, a backup form of contraception would be a condom.
Right. Or in the fertility-based awareness model, maybe even abstinence.
Yes.
Hands off during that week.
Yeah. Right. So other than just going by the calendar and calculating the time that you're going to ovulate, there are other ways to track ovulation, like basal body temperature monitoring, cervical mucus changes, and even ovulation tests. Tell us a little bit more about those.
Yeah, those are all methods that people have used to determine exactly when it is they're ovulating in their cycle.
And they could be used to avoid or to get pregnant.
And it's not always as simple as that time interval that I explained earlier, as far as the 14 days, before your menses occurs. So some people track their cervical mucus. Right after your period, you should have some bleeding, and then you should have a few days, 3 to 4 days, where there's nothing, no discharge or anything. Over 3 to 4 days after that, a little bit of a thicker type mucus. But then in the middle of your cycle, when you ovulate, it should become a lot thinner, more watery. And people have tracked that to know when they're ovulating in their cycle.
This happens before and during, but not after.
Correct. And it is a little bit labor intensive, if you can imagine tracking your cervical mucus. Another labor intensive method is the basal body temperature method, where your temperature around the time of ovulation, or the LH surge that triggers ovulation, your body does jump about a half degree in as far as its base temperature. So in order to do this, you have to take your temperature every single morning at the same time
before you get up and
before
do
you get
anything.
out of bed, and you need to track that. And then as soon as you see that that temperature jumps by that 0.5 degree, you know that that LH surge has occurred and that likely you'll be ovulating.
So does your temperature remain elevated until your next period starts?
So as soon as we see that elevation in temperature when that LH surge and the ovulation occurs, it usually continues through the remainder of your cycle, right up until a few days before your next period occurs.
Good to know if you're using that method to track ovulation. What about ovulation test kits?
So ovulation test kits are a great way to determine whether or not you've ovulated. It's a commercial test that a number of manufacturers produce that's available over the counter. Some women use it to slowly track to see exactly when it is they're ovulating. A lot of the manufacturers suggest that you start testing approximately day 9 of your cycle, meaning 9 days after your period started, and then track all the way through until you get a positive test. Usually once that positive test occurs, you only have a narrow window of time to become pregnant, and so usually about 1 to 2 days.
So it may be helpful to use those after you've been trying for several months without success if you're trying to get pregnant. Probably not the best method to use if you're wanting to avoid pregnancy.
Right, if you're wanting to avoid pregnancy, there's other...
They're very labor intensive, they can cost a lot.
And there's much more effective means out there. And so if you're really tracking this along in order to not become pregnant, you're doing too much work.
Go get some good forms of birth control that are reliable you don't have to think much about.
I think so.
Yeah. So the withdrawal method is the one thing we haven't talked about. That's probably the least reliable form of contraception, would you say?
I would say it's not effective. Some people say, hey, I do it every time and it's very effective for me and my partner. But the truth is that most people aren't able to use that method every time and it fails very regularly.
Even if withdrawal happened at the proper time, there's still a chance the woman could conceive because there's actually sperm in pre-ejaculatory fluid, correct?
There is. In fact, there is a little gland that sometimes sperm can hang out inside of that reproductive tract. And the next time things get going, they could come out. But let's just say there's sperm.
Safe assumption to make. So if you're not wanting to get pregnant, you're very serious about preventing pregnancy, it would probably be best to talk with your doctor about a reliable form of contraception. Do you think that's
Absolutely.
The safest thing to do?
Yeah, there's so many different options available. I think you will find one that works well for you, for your lifestyle, gives you the control that you need and that you're happy with, and has an acceptable side effect profile.
Great advice. Thank you so much for taking time to be with us today. If you have questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.